All right. Well, good evening, everybody. This is Dr. Ellithorpe with Tustin Longevity here in Southern California. We meet every Tuesday at 6 o'clock till 7 o'clock. We take your questions on health and preventative functional medicine. We are functional medicine providers here. We've been doing this for, maybe in this location, close to 25 years here at this location. And I've been involved in food research and publication on this and publishing scientific journals on this for the past 40 plus years. So we like to provide a time for you to ask a question, whether you're a patient of ours here or a family friend. We are doing this for educational purposes. This isn't meant to manage anyone in particular through the YouTube. We're just doing general responses to how we would manage questions on functional issues. We do this through a series of email questions. If you want to send us a question, you can go to tlcdoctors.com. There, you can get on our newsletter, and on the newsletter, then you'll get a link notifying you of the upcoming video. And on that link, you can type in your question here. There's a limited amount of characters, so you don't give us too much of a lengthy history and physical kind of story. And then you ask your question and it'll be sent in. I try and get through them all every week. Sometimes a few dribble over into the next week. So I'll be starting with the ones I didn't finish last week. And then we also have a second way for you to get a hold of us through the YouTube. If you're on YouTube and you get in the chat group, you can type us in the live chat here a question. And I try to get to the live chat initially. And with that, I want to, note that yesterday there was a meeting in the Oval Office about Secretary of Health, Human Services, Kennedy, and the staff of the CDC, HHS, and FDA, all of them talking about their collective and hopeful management of looking at the vaccine schedule that is currently being used, and they're likely going to be extending and maybe limiting some of the vaccines that are recommended for the youth. I think this is a great step forward into open question of protocols. I think we need to review what we're doing. There's always a thing called continuing medical education. I think the input of functional medicine, lifestyle medicine, and other natural ways to improve the immune system to resist viral infections or improve the community health is being ignored because it's non-profitable to certain industries. Therefore, this motion to have a body of physicians and leaders in the cabinet is most encouraging to see. So I was very happy to report that to you that is happening. All right, so the first question I have on the internet is from a Rochelle, and this was from last week. I have 4 questions I didn't get to last week. Rochelle said, is there anything I can do to get rid of or lessen the dark pigmentation from the sun on my legs and arms and chest? Dermatologists call them sunspots or liver spots. I do not go into the sun without sunscreen. I would like them gone. Is there anything? So let's see, Rochelle, we would want to ask questions like, how old are you? Are you on any prescription medications? Do you have any other comorbidities or illnesses? How is your microcirculation? What is your heavy metal burden? Because as the tiny capillaries get older, the connection between one cell to the next gets broken apart, and we get what we call leaky capillaries, and red blood cells can leak through. And the red blood cells have hemoglobin, which is bound to iron. Iron deposits can be dropped into your skin, and that's pretty much a permanent stain, like a tattoo. So people who have chronic edema, and inflammation of their lower extremities. They get these broken tiny capillaries and blood vessels, and they start looking like they have brown socks on their feet. And that's from the iron deposits from the red blood cells that have leaked through the pore junctions, became loose and opened up, and then the red blood cells leaked through. The other thing is, as we age also and have disease and general metabolic breakdown, is oxidative stress. When you have oxidative stress, fats that make up half of the cell membrane. So a cell membrane is a bilipid layer, and it goes all the way around the cell like that. It's made of fats and proteins. These fats can get, so to say, oxidized or burnt. When they're burnt like that, we call it lipofuscin. Lipofuscin creates these brown spots. We call them liver spots. And that's just showing your level of repair and oxidative function is aging and diminishing. One of the good things about taking highly researched, well proven nutraceuticals is it gives you antioxidants. And we've been doing this here for at least 30 years. I've been recommending it entirely as my main antioxidant, the Juice Plus, which is the fruits, vegetables, and berries that are put in a capsule and dehydrated to make available all the polyphenols, antioxidants that help the level of protection of the human body on many, many different levels. One is your skin quality is easily seen if you've been taking antioxidants for many years. And we've been doing this. I've been doing that. I think it has benefited me over my 72 years of life, and the amount of stress that I've been under will generate a lot of oxidative stress. And I really do think that my Juice Plus, all these years since about 1999, has really been a great benefit to slowing my aging. Uh, Also, for instance, like cataracts, I don't have the early hints of aging eyes or that kind of stuff. I do take EDTA chelation that helps pull out the heavy metals. There may be some value to that for the iron deposits that are in the body. If you do chelation therapy, for sure, it'll help the microcirculation so you don't continue to have as much capillary damage and leaking of the iron in each red blood cell to be deposited into the connective tissue. So, outside of that, I don't know of any other real thing that I can tell you. The whole lifestyle of a low oxidative, stressful life: drink your water, get a good night's sleep, ground yourself, and eat healthy, grass fed, wild caught, prairie raised, natural beef and poultry and fish and such. And don't eat late at night because our digestion slows. And if the digestion slows, it's staying into our system too long. Our stomach is still having too much food in it, so that when we lay down, the body will not release growth repair hormones when it senses a full stomach. Takes, probably 4, 6, maybe even 8 hours for an older person to empty their stomach out as they age. And then, God forbid, all these people using Ozempic and all these semaglutides, GLP-1 and GLP inhibitors. Uh, uh, these medications are slowing down gut transit times, which are going to produce constipation and gut paresis, slowing, and that will stop some of our growth repair time. So it's a big mess when we think we know how to jiggle with a certain molecule and create a downstream effect of a lot of damage. Okay, so we're getting some live questions here. SBM Jen says, what do you recommend for joint pain due to pickleball, the knee and the plantar fasciitis? Well, again, your age is going to matter. If you're over 40 years old, it's very likely that your rate of repair for micro trauma is limited. So the frequency and length of time you do it may need to be cut down. Although I'm very much in favor of exercise, the sudden stop and starting of this may create tiny micro tears in the tendons and cartilage there. Remember, the knee doesn't have any per se blood supply. It's the cartilage lining, the top bone and the bottom bone and the patella. And the only way fluid gets in there is through one little synovial artery, and all the diffusion of good nutrients and repair nutrients or removing waste material is very limited. So you have to be very well hydrated. I would take systemic enzymes because we lose them with age, and that helps reduce inflammation. I would get a very good night's sleep and not eat late. I would stop eating somewhere around 3 in the afternoon, especially if you're near to 60 years old or older. And I would eat a rich protein, healthy diet of grass fed only beef and wild caught fish and prairie raised animals that don't get insecticide exposure or hormones injected into them. So that'll help repair the cell membranes made of the proteins and fats. The enzymes will disinflame. The water will help the microcirculation. Of course, you could always do EDTA chelation to enhance that. And the richness of the collagen and the protein that's in the meat and fish and chicken and pork and materials that are made of these things will help speed up the repair of the joint that is stretched out and irritated and inflamed from pickleball. So there you go. The next question I have is from Tanya. Tanya says, I'm a 54-year-old female, 192 pounds. I take no vitamins. Should I be taking any supplements? I have no medical problems. Well, I don't have any medical problems either, and I'm 72. And I would say one of the things that I have to realize is that we're in a more chemically polluted, energy polluted, light polluted environment. On top of the chemtrails that dump, boron and aluminum particles, aluminum oxides. These are scattered in the air as they film out of these airplanes. And you see the trail for hours and days, even as the film spreads out. This has tiny metallic particles that reflect waves of energy off of it. So you can, from the ground, bounce energy waves on it and create a dome, which will create some weather changes. It also will deflect waves of energy coming from space, such as to heat the planet. So we're messing around with that, but ultimately it lands on all the trees, the ground, and the forests are turning into tinder sparks because aluminum is a known pyro accelerant. In other words, aluminum is a thing that will help ignite and start fires more easily. So we're having the aluminum powder all over the earth and in our forests that are aggravating it. When you think of that and getting on our soil, your plants grow up with these toxins in it. Industrial farming has taken away the love of personal families nurturing and watching over the soil of their land and rotating it and nurturing it. So we are literally getting less quality food, less nutrient dense food that's artificially modified and made to have more sugar. And I appeal to its beauty rather than its nutritive content and value. So given all the food corruption, the chemicals, the heavy metals, the energetic waves that are detrimental, the oxidative stress, the challenge to stay healthy today is increased. And we can also see that with the explosion of the chronic medical problems we're seeing in our young children. We are made of cells, and these cells have a membrane that's protein and fat. It's a bilipid layer, and it goes all the way around the cell. This is made of fat and protein. Your body is composed of fats and proteins. We're not made of fruits and vegetables. We take out of fruits and vegetables certain micronutrients if we can digest them. But with all the stress, we're digesting less well. And we cannot repair the trillions of cells and the micro damages that we're accumulating at, I think, a faster rate these days. So if you say, do I think you need to take supplements? I'm going to say I have universally seen massive vitamin D deficiencies, and those in people who sit in my office here and say, I eat well, I eat a healthy diet, quote unquote. All I do, decade after decade after decade after decade, is see patients for the most part who think they are doing well. And I see massive vitamin D deficiencies. I see significant water soluble B vitamin deficiencies because you urinate them away. They're water soluble, so you can easily lose them, as opposed to vitamin D, which is a fat soluble. It doesn't tend to be as rapidly lost. I see almost everyone is iodine deficient. I would say upwards of 96% of all my patients are maybe iodine deficient, 97% deficient. I see most of all of my patients having metabolic syndrome, early signs of insulin resistance from a high sugar diet that's oxidatively stressing their body. So, yeah, I give iodine, I give vitamin D, I give a good antioxidant, methylated B complex, uh, amino acid chelated minerals, and I will give them. I'm against fish oils. I am for uh, linoleic alpha linoleic acid because we're not fish. We're at 98.6 degrees. When you take in a 5 double bond uh, 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 EPA and 6 double bond DHA fatty acid chains, they become they're unstable. They easily become oxidized or rancid, and you're taking in largely, I think, rancid fats and oxidatively stressing your body. God designed us to have a 2 double bond in linoleic and a 3 double bond in alpha linoleic acid. So I give the correct clinician's preference oil. And let's see, what else do I give? Juice plus the antioxidant. Those are the core items that I use. So yes, I do think you need some supplementation in today's world. Kathy says, my 87-year-old but physically and mentally fit mother tripped on a step, oh, sorry, and hit her head on a tile floor. So, since she's in good shape for her age, she was able to get up by herself, yet she has a few bruises under her eyes. That's not good. How to determine if she had a head concussion? She refuses urgent care or the MD. When did this come in? This was one of the ones I didn't get to last week. Oh, so this is 1 week old. No, I would have this looked at, Kathy, because bruising under the eyes, unless she, hit her head right onto her forehead, it may imply that she has a more fragile body and tiny bleeds could occur in the brain. You could get a subdural hematoma. I wouldn't fool around with anything like that. She needs to be seen and evaluated by a doctor. Yes, I know it's been a week now since you sent this question in. Even still, I would have her evaluated and looked at for this reason. And uh, yeah, I would go to her doctor and handle it that way. I can't tell you how important it is. Any trauma to the head in a older person puts them at a significant risk for even a minor head trauma for a bleed, because you don't know if she took aspirin that day or she's on some other prescription medicine. Please take her in. Deidre says, hi, Dr. Ellithorpe. My mom is 87, two 87-year-old questions in a row. Okay, two different ladies. And she has stage 4 kidney disease and recently took a blood test for Alzheimer's, which was positive. Sounds like she took the ApoE4 test. Uh, since she's at the beginning stage, her neurologist prescribed uh, donepezil, which is Aricept, 5 milligrams. Donepezil is Donepezil, to help her with memory and clarity. Is there a supplement she can take instead? I recommend a lifestyle approach. We would tell you that the brain and the tissues are made of fat and protein. And the fat and protein of the brain, the fat content is even higher. So, a largely carnivore diet, very low carb, always helps with mental clarity. Fasting, having intermittent fasting times, generates ketones, and that helps mental clarity. Doing exercise with resistance training and aerobic walking or stationary biking is very helpful for memory. Taking vitamin D is very mood lifting. It's a fat soluble and helpful with memory. Taking magnesium or a very good multimineral is very important in cofactors for helping brain repair. The choline in the acetylcholine seed, Aricept, this medicine you were given, is a cholinesterase inhibitor. It tries to prevent the breakdown of the acetylcholine, which is a neurotransmitter. And you should be eating a lot of the meat, fish, chicken, beef, egg yolks to get the choline and these precursors there for her to be able to make coenzyme A and acetylcholine, choline from the fats. So, a high fat diet rich in animal foods, stop eating after 3 o'clock in the afternoon, exercise, be well hydrated, make sure she's getting at least 64 ounces of water. Have her taking a multi-mineral with magnesium in it, vitamin D, at least 5,000 international units is what we start here. All our patients with memory problems with. The other thing is I put all my memory patients on hormone replacement therapy because estradiol will help arouse the brain and improve the depth of sleep and quality of repair at night. So we use natural hormone replacement therapy along with exercise and vitamin D, multiminerals, methylated B complex to prevent the ApoE methylation problems with having uh, negative effects on oxidative stress and aging on the patient. So there's a book out there, and there's a neurologist by the name of Dr. Bredesen. I taught him everything he knows. That's a joke. But everything he has in his book, we've been doing long before he wrote his book because we've been doing this 40 plus years. And I'm glad to see the specialists finally doing something and making it popular over the past 10 or 20 years. But, it took wonderful doctors like Julian Whitaker and Linus Pauling and Dr. Klenner in North Carolina with vitamin C, Dr. Ray Evers for EDTA chelation. I mean, these giants in the field existed long before me, and they taught me. Dr. Ray Evers was my physician. And so then we carried on the mantle from them. And so I think we've just been pushing the envelope. And now finally, we're seeing these specialists finally um, like Dr. Perlmutter, Dr. Bredesen, all these guys are finally coming out from behind the trees and writing their books. And we thank them for admitting that the nutritional lifestyle was the correct way to go. That's not to say surgeries and certain drugs aren't beneficial or potentially valuable, but certainly not to the expense of not being taught about all the lifestyle things that must be done that help a family grow up healthy and a community grow up healthy and a state and nation grow up healthy. So we have to restore this training and give honor to our forefathers and no one take any individual credit because it's all one big process where God's trying to wake up all of us and we should all do our job. And we don't need a pat on the back. That's our reasonable service to the industry for the betterment of mankind. All right, so that's what I would start to do for your mom with Alzheimer's. The 84-year-old, no, the 87-year-old with kidney disease, rather, she's the one who we were talking about who got the Aricept and what we could do. There are other nutraceuticals. We use vinpocetine in a product called Membrin, Membrin, along with that to help memory. and then try and find a good functional doctor in your area, and then uh, just keep on asking questions and let us know how she's doing. Cheryl says, I want to use ivermectin and fenbendazole or menbendazole for liver cancer and cirrhosis. Okay. I have not taken chemo or radiation. Can you provide information? Well, I would say these are not the standard of care. You should have an oncologist that you go to and you ask your questions about. If they don't have any information or uh, help you, there is a gentleman by the name of two people. One is called Dr. Casey, Casey Peavler, Peavler, and he is on YouTube. So if you go onto YouTube and type in Dr. Casey Peavler, click on his website, you'll see his round face in the picture there. Hit it, and you'll see his. I think it's called metabolic uh, pathways. YouTube, and there you can look on his fenbendazole research, and he goes with current research on fenbendazole, ivermectin, vitamin D, enzymes, uh, berberine, vitamin C, all these kind of things, and the ketogenic diet, all these various things he goes over. Dr. Casey Peavler, Peavler, does an excellent job. There's a book out there written by Dr. Thomas Seyfried, Seifried, PhD. Dr. Thomas Seyfried, Seifreid, PhD. And the name of his book is Cancer is a Mitochondrial Metabolic Disease. And this is what Dr. Casey Peavler read, got all excited and made his YouTube about. We've known about this and we're doing this in the 1990s when I was working with Dr. Brzezinski in Houston, Texas, on his anti-neoplastin therapy for brain tumors. And we've had survival of glioblastoma multiformes all my practice for years and years and decades. And so this is nothing new. It's just finally getting into the mainstream. So we're most thankful to God that he has made this available, and that some people have had the blessing of getting notoriety over this. So we thank the Lord for it. But those are two resources for you that may be helpful for you. But do share it with your oncologist. Remember, your oncologist is also under pressure to learn the nutritional ways now, and do some homework and earn his income. Oncologists are the highest paid doctors, so they certainly can do some more homework and learn about these things. Give them the name of Dr. Casey Peavler and Dr. Thomas Seyfried, and share with them what you're doing, and find a functional doctor nearby you to help you, and work openly and share the information and help everyone this way. Let's see, we're getting more live questions. So Alabiosa says, when starting a hormone replacement regimen, not menopausal yet, how can I tell when menses is breakthrough or maybe something more serious? What day should I use progesterone with estradiol when cycle is upset? In general, if you're premenopausal or just beginning to get near perimenopause, I tell you, I'm usually having my young ladies, even teenagers, all of them, go on natural progesterone cream day 15 of their menstrual cycle to day 25, because there's so much stress. The cortisol hormone is released under stress. It blocks follicle stimulating hormone, so you don't get your ovulation. Then you get estrogen dominant. Then you get the lining built up too big in the uterus. You get fibroids. On top of that, most of us are eating a lousy, high carb, high fructose corn syrup diet. That insulin is a growth promoter. It'll promote fibroids and thickening of the lining of the endometrium as well. So I recommend natural progesterone cream day 15 through 25 of every woman on earth, because it's so stressful. And day 1 is the first day of our menstrual period. So 15 days from the start of our menstrual period to day 25 is when you do it. And that would augment ovulation. Women normally ovulate around day 7 to 15. So if you start the progesterone day 15 or 16, you're not going to interfere with your own progesterone ovulational production. So that's a very wonderful supportive thing to undergird all natural feminine cycles, improve the fertility, reduce endometriosis, along with a low carb diet and exercise, and reduce fibroids and cramping. All these wonderful things occur when you do that. That's what I would encourage you to do. Now, I still cycle. I'm 72 and I still have a monthly menstrual cycle because I take progesterone day 1 through 15 of every month because I don't have a cycle to follow anymore. And I take my estradiol cream every day of my life. So I generate a certain level of estradiol in my system, just enough so I don't get hot flashes or night sweats, just enough that it builds the lining of my uterus up a little bit. So by the time I start progesterone the first of the month through the 15th, it builds up enough. So when I stop it on the 15th or just right before, I start to have a little cleaning and breakthrough release of my lining of my uterus and get a very tiny, very, very light, mild menstrual cycle. So I have never had menopause. I've never gone through those symptoms. I've never lost my sleep over it. My bones are excellent and normal in bone density. My energy is and stamina and my immune, my heart, my skin, my hair, all these things are supported because they're general contractors to the human body in helping staying functional and healthy. So hopefully that helps you, Alabosia. Um, and find a good functional doctor who can help you with that. Keep on going to different functional doctors until you find that you see someone who has experience and is going to work with you and test your levels and compare them with how you feel. Fanny says, help with menopause, please. Vitamins, lack of sleep, night sweats. Well, Fanny, you need to see a doctor who is familiar with prescribing estradiol and natural progesterone. And I prefer cyclical, although there are those who do continuous of both. Normally, progesterone is cyclical in a woman's body, so I often will offer cyclical, but I tell the woman she'll probably wind up having a little menstrual period once a month. But you have to measure the levels and see how much estradiol is and get a steady state over the course of a year or two and see how our body responds. Very often, we have them go to their gynecologists or get a pelvic ultrasound and look at the lining of the uterus, their fallopian tubes, and their ovaries. But you need to find a doctor who will give you estradiol and progesterone to help you get rid of these night sweats and help you get some good sleep. Vitamins are the ones I mentioned earlier. Vitamin D helps with the mood. It helps as a bone builder and an anti-cancer effect. You want the multi-minerals with the magnesium, especially to help you relax. You want iodine to help your mental acuity and to help you with your thyroid function. And you want a good antioxidant. I always recommend the Juice Plus series. These are the antioxidants, that are rich in all the colors of the fruits and vegetables and berries. And then I would use systemic enzymes. I always give systemic enzymes to women who are on natural hormones. We also lose our enzymes, and with that, we get more stiff and less cleaning. There's more debris, so you get stiff all over. I thank the Lord, I just don't have a stiff bone or joint in my whole 72-year-old body, and I can just bend over, lift, and do everything I need to do. Glory be to God. But I am taking the enzymes and I drink the water and I eat a low carb diet and I won't eat late. So if a woman in my practice will not drink her water, not exercise, not take her enzymes and be low carb, then I won't give her the hormones because she's trying to uh, give it into a failing vessel that's going to have breakdown problems. If you're going to do hormones, you need to drink the water, exercise, you need to be low carb, not eat late, and take the enzymes. And then I would certainly recommend the D the antioxidants, the multiminerals, the methylated B complex, and the iodine. Hopefully that helps you. I hope you find a good functional Dr. Fanny. And Elviosa also added, if the cycle is off now and can't tell what first day is doing, do I just start on day 15 anyway? Yeah, very, very often I will just set a 10-day sequence in the calendar month. So 15 to 25 of the month. And then your body should start behaving better. But again, you need to have experience. I need to know how old you are. I would need to see what your blood levels are, any other comorbidities, what your weight is. Your blood type also has great help in understanding your metabolism, how well hydrated you are, how active you are with exercise. But yeah, you can just pick out a 10-day period of time, put on the progesterone, and then see how your cycle responds to that messaging. And then once you get what you think is a clear period starting, just declare that's day one. But if this is always changing, then at some point it's like a dance. Should the man lead, or when does the man lead in the dance? Well, when they know what they're doing. So when does the doctor lead with the hormones and just give the estradiol and give the cyclical progesterone, like I'm on a fixed calendar progesterone the 1st through the 15th and estradiol every day? Well, I do it with my blood levels. I've checked compared to my symptoms, and I feel great, and I get a very slight menstrual cycle, and so I'm very happy and healthy. I don't freak out because I have a menstrual cycle every month in my 70s, and I don't need an OBGYN to examine me. And you need a doctor who knows how to work that with you and find out where you are in your cycle. All right. So God bless you. Let's go back to our questions on the email. Let's see. Art says, is DMSO, dimethyl sulfoxide, DMSO, safe for body to process? It helps. DMSO is helpful in like a solvent. Let's say it's a solvent. So it helps like soap. If you put soap in the dishwater, it loosens up the grease on the pan so you can wash the pan. DMSO is like a solvent like that. And so the question then is DMSO safe for the body to process? Well, I don't believe in taking DMSO necessarily. I used to many years ago in the 1990s when I worked with Julian Whitaker in Newport Beach at Whitaker Wellness Institute on Birch Street there. It's now closed. But we used a lot of DMSO, but the sulfur smell, it smelled like garlic all the time. And eventually we would put it in the IVs. So yes, you can take it internally. So yes, it's safe. But I saw no added benefit to my knowledge that it helped with chelation any more than if you left the DMSO out. So we at ACAM, and I used to teach chelation to the doctors for many years all around the world who had come to the American Academy for the Advancement of Medicine on how to get certified for administering chelation therapy. We don't recommend adding in DMSO because why add something that isn't necessarily making things better? So this is more in a topical for joint pain and topical applications. And so that's what I think about it is DSMO. It should be DMSO, safe for the body to process. The answer is yes. Do I have to dilute it even if I'm using a teaspoon dose? It's I've always heard that you should recommend it at least 50-50 with distilled water. It relieves pain in my feet, but I'm concerned it's a byproduct of industrial processing. No, Art, I think it's still safe to do topically. But again, I am not an expert in this, and the last time I ever used it was in the 1990s. So you can find a lot of naturopathic doctors who use more DMSO than I ever will. And maybe you can find one who knows more than I do on that. I hope that helps you, Art. Katharina says, I'm 6 years old and was recently diagnosed with osteoporosis. In addition to weight training 3 to 4 times a week and eating more protein, are 24-hour fasts on a weekly basis good to continue? Yeah, I think it's just fine. I don't believe in prolonged fasts. I do a prolonged fast myself twice a year. I do it on September 1st, Labor Day, and I do it January 1st. And that's because in my personal life, August is full of a lot of birthdays and my anniversary. And so there's too many occasions in my personal immediate family where we're having a party or something. And the same with Christmas, too many eating of bad food. So January 1st, I always fast for 3 or 5 days. But outside of that, a 24-hour fast once a week is very health promoting. I couldn't imagine doing anything other than benefiting and deacidifying your whole body, which will improve bone density. Yeah, and keep up your weight training. Make sure you're doing serious weight training. I recommend the machines only, and I recommend it at your level, but don't baby yourself. Push those weights or the number of repetitions until you start feeling some burn in your muscle to exhaustion there. And then I also talk about stomping your feet and getting that sudden deceleration up your body, getting a rubber hammer and hitting something, getting that sudden deceleration up your wrist and arm. That's also, and then vitamin D levels, when you test the blood, somewhere in the range of 80 to 100 on your blood tests. I don't like these 50, 60 ranges. And I also recommend natural hormone replacement therapy. All right. Mary says, what would you recommend to a lady in pre-menopause who's around 50 and having very severe extended? I think that you already put that question in there already. Okay. So we'll skip that one because I answered that question already. Teresa says, are bioidentical hormones safe compared to regular hormones? All right, so you have to understand, most doctors are not really trained well. They don't get enough chemistry, biochemistry. They get basic chemistry 101, and they get organic chemistry a semester, and that's it. Now, they better understand their chemistry a lot better because everything's about learning how to read scientific papers. I certainly do wish that every doctor would be required to get published and learn how to publish papers so they can understand this. But regarding hormones, we used to use equine estrogens from horses to make Premarin, and then we use synthetic fake progestins, which are synthetic progesterone mimickers, and they are associated even on the Women's Health Initiative of 2002. It was associated with that fake progestin, Provera, with an increase in breast cancer. So these are synthetic hormones. This is what people usually called back in the 60s, 70s, 80s, and 90s regular hormones. That used to be Premarin and Provera. Then with doctors like myself and the ones before me that helped train me, and the ones I've influenced that help the not doctors now that are coming out from the trees and starting with their board certified neurology and board certified OBGYN, they're board certified cardiology and board certified dermatology and board certified neurology. All they're coming out because they realize natural hormones help everything because they're general contractors. But what they need to understand is the human bioidentical estradiol is the female hormone of import and magnitude that helps with hot flashes. Estrone doesn't, estriol doesn't. It may have a tiny benefit locally right at the vaginal area, especially in women who cannot take any estradiol. Let's say if their oncologist says they can't use estradiol, so they'll use estriol. So natural human bioidentical testosterone, human bioidentical estradiol, a human bioidentical progesterone, and there's only one progesterone, just one molecule, progesterone. Estradiol has a title name for three types. One is estradiol, one is estrone, and one is estriol. But the estrogen title has three of them in there, but only the estradiol is the one that has any meaningfulness in use. And I don't like this fancy jazzed up bias, trias, mixing them all up into one thing. You can't manage it well. So I think everyone's trying to pull the wool over their eyes like they know something super duper about hormone replacement therapy, when really you just need to use the estradiol and find out the dose and the delivery method that works for your patient, and progesterone. Those two things, learn them. Okay, that's what I have to say, and stop with this foolish bias, trias foolishness marketing. Um, Ligia says, does taking magnesium with thyroid medication interact with each other negatively? I have no knowledge that there's a negative interaction. No, Ligia, it does not. Marie says, hi, Dr. Rita. This is Marie. I'm a patient of yours. I have many, many Maries. I don't know which one. My cousin in Arizona has colon cancer. I'm sorry to hear that, Marie. And unfortunately, she is allergic to a lot of things. She will be going on chemo, but she wants to do as much holistically as she can. Do you recommend a keto diet? Yes, I do. Carnivore is even better. Do you think fasting would help? Absolutely. She is allergic to almost everything. I would, in Arizona, there are several anti-aging alternative functional medicine clinics in the Scottsdale, Phoenix, Arizona area. And I would call and look at that and explain to the office manager that you have colon cancer. Is your clinician there familiar with natural supportive therapies like high dose vitamin C, EDTA chelation, ozone therapy, hyperbaric oxygen therapy, managing a ketogenic or carnivore diet, doing maybe even looking into fenbendazole and ivermectin or menbendazole. Look into the Dr. Casey Peevler, look up Dr. Thomas Seyfried, both of them on YouTube. You can read Dr. Seyfried's book called Cancer is a Mitochondrial Metabolic Disease. All those things should be a big help to you for your cousin Marie, and that's what I would do. Yasmin says, hi, Dr. E. I'll be 48 in October. Well, happy 48 years old. And recently I saw a doctor who said I'm due for a colonoscopy. I've never had one, and they sound quite invasive. So I was curious what your thoughts are on that procedure. Thank you. Well, Yasmin, I want to tell you, my brother-in-law died of colon cancer. So I have my biases. I do try and let my patients know who see me my biases. I tell them my worldview is as a Christian, and I see each patient as a creation of God, and I have to try and do my best to honor God's creation, because I answer to God every day, every night when I go to sleep. If I think about what I've done in the day, or is there anything I could have done better. And one of the biases is my brother-in-law who died of colon cancer. I was 38 years old. I think he was 45. And he was married to my older sister. And he was working with my husband, construction. They looked great, healthy. We took him out to a steak dinner. And then my sister called me a few days later and said, David's ankles were swollen. And I thought that was very odd for a 45-year-old man. And, I kind of blew it off because I knew I'd be seeing him relatively soon. And I said, well, if it gets worse, call me, certainly within a week. So she called me dutifully a week later, and she said the swelling's up to his knees. Well, I freaked out. I was an ER doctor, and I had him come to my emergency room. And we did a CAT scan, and we saw the CAT scan. His abdomen was full of metastatic colon cancer to his liver and so forth. Unfortunately, right before my eyes, without any symptoms, he was without complaint. He was a lovely, godly man. and he worked, and he had a servant's heart, and he just never complained. And so within a month, he was gone. So this was back in 1995 when this happened. So I have a low threshold. I do value getting at least, your initial colonoscopy done. If you had the injection of the SARS-CoV-2 mRNA, I think there's concern that there may be some immune risk and higher risk for developing other serious disorders. So I would have that checked, especially if you did that injection. So yes, I would do it. And, you know, yeah, there's a risk getting in your car tomorrow and driving anywhere or getting on a plane. Theoretically, you could get in a terrible accident or the plane could crash. So we live around judgment calls, but I think the risk from the poor diet, the tumor promoting high carb, high fructose corn syrup diets are so growth promoting, fat promoting, cancer producing that I think the risk of one colonoscopy is not to be compared to the value of the peace of mind that you get from what it looks like. Uh, in my 45 years of practice, I would say I've had one patient, I think, who had a colon perforation that had to be kept in the hospital until they got better, and they were fine. So it's extremely rare. Emily says, is there a bone protective amount of bioidentical hormone replacement therapy recommendation when dealing with osteoporosis? Well, your doctor has to be informed enough to understand that a progesterone level has to be at least around a 4 to 6 nanograms per deciliter sample in your blood. And the estradiol should probably at least be around 75 nanograms per deciliter. So, yeah, I would say about a 75 estradiol and about a 6 for the progesterone is what I'd be generally looking for. And you'll see the beneficial effects at that level. When you go to the gym, she asks, are you being observed by a personal trainer? No. I've completed a few sessions with a physical therapist for osteoporosis, but now I'm on my own. Well, good. Just get out there, push the metal, and be faithful and stomp. I'm on my own for those high impact resistance exercises. Most of these gyms do not have anyone familiar with osteoporosis to offer guidance. Look we all get in a car and we don't have our car driver's trainer. Just get in the gym. I recommend using the machines only so that you can't have a mistake with holding a free weight and fall and pull and jerk your muscles. Just use those machines and you should do very fine. That's what I recommend. Mickey says, when taking supplements such as Proven MD, that is my private labeled vitamins that I've developed, multimin or methyl B complex, for which multiple capsules are recommended. Do you recommend spacing them out over the course of the day or all at once? I take them all at once. So I don't think there's any credible research out there saying with food, without food, all at once or spread out. It just doesn't exist. We are so busy. We are so active. You have to work out what's best for you, but I take mine all at once. Okay, Mickey, let's see. Some live questions came in. Christina says, hi, Dr. Rita. Is there any way to reverse liver failure? Yes. 67-year-old male due to alcohol, weighs 133 pounds. Vitals are good. What should his diet be at home? In the hospital for ammonia toxicity, slowly getting better. He needs to be under the care of a good functional medicine doctor. My niece, actually the gentleman who was my brother-in-law, his daughter abused alcohol and got liver disease and the toxicity and had to go on the hepatologist management for the encephalopathy that comes from the ammonia poisoning. So yeah, I'm very familiar with it. And we took care of all of her nutritional needs. We put her on alpha lipoic acid. I had given my own niece with those same problems about 500 milligrams 3 times a day. I also gave her anti-inflammatories such as systemic enzymes on an empty stomach 3 times a day to help improve the circulation. I made sure she drank about 64 ounces of water every day. I made sure that she ate a largely roasted chicken, prairie raised, wild caught fish, with only one cooked vegetable at a time. That was mostly a high fiber vegetables like broccoli with the beef, and I would give Brussels sprouts with the chicken, and I would give green beans with the pork loin, and then eggs and a little raw cheese for an omelet. So she had 4 menus, and she only ate breakfasts and lunches, rich protein, buttered everything, salt and pepper. She took her multiminerals, she took an iodine, and she took, what else did I give her? I gave her the antioxidants, Juice Plus as an antioxidant. And I held off the vitamin D because that's fat soluble, and I slowly titrated her up on her vitamin D, and I checked the blood levels on that quite often because the liver has to process fat soluble vitamins. I gave her high dose vitamin C infusions, IVs of 25 grams of vitamin C twice a week. What else did I give her? Alpha lipoic acid, yeah. So that's what I did. She was on a very low carb diet. Find a good functional doctor. You can talk about the things I used for my niece, and then uh, see if that's a help. Go to acam.org, acam.org, and find a functional doctor in your area that can help work with you and the hepatologist. But yes, she's totally fine now and recovered. So we thank the Lord. And it just goes to show you, don't judge a person and throw them in the waste bin because they suffer an addiction. We who are mature in the Lord, we have to be long suffering and patient. I will never give up on helping people. I will never give up on helping anyone who is asking for help. I will always offer love and help, no matter what the addiction, no matter what the problem. All right. Let's see. We have a live question. DM Thomas says, "Hi, Dr. Rita. Do you recommend adding collagen to a diet for a 61-year-old lady? My sister-in-law recommends it. Thank you." If you eat enough meat and pork and chicken and these animal products are so full of collagen and elastin fibers, you're probably going to get enough, and it's all bioavailable. The problem with over-the-counter purchases of collagen, unless you get a high quality, I do carry the orthomolecular series called collagen, and their size of the collagen molecule called a Dalton size has been researched and studied with orthopedic clinical studies for bone density and imaging. So we use clinically researched material. But I always tell my patients, you've got to eat this in your life. You can't keep on buying supplements. But yes, I'm in favor of collagen, but preferably from eating it from your animal sources every day of your life. Let's see, any new one? Christina? Oh, thank you so much. I'll do that. Who is that, Christina? Oh, okay. So that was for your friend with the liver issue. God bless him. Tell him I'm praying for him. I don't care how old they are, too. I was so blessed to see my own father get saved as an adult, so you don't give up on people. My father bent his knee to the Lord Jesus Christ as an adult, and I got to witness his baptism in a Lutheran church. So look, at people are amazing and made in the image of God. And so guess what? Yea, though he slay me, yet will I trust him. That's in Job. Just trust God. He knows what he's doing, and he'll give you the strength to endure all the hassle that you go through. I so am proud of my patients who are taking care of their elderly siblings and parents, and they suffer so much, but they're just doing it. So I'm so proud of my my patients who do that. Let me try and get a few more of these emails in. Constance says, do you recommend multi different types of magnesium in one supplement or specific magnesium? For example, I take magnesium glycinate at night only. 72 years young, but some hamstring cramps during the night. That this seems to help. Yeah, I don't like oxides. I don't like magnesium oxide. These are inorganic magnesium. So magnesium glycine, magnesium glycinate, magnesium taurate, magnesium malate, magnesium sulfate. Although that's the least I use is magnesium sulfate. So yeah, magnesium citrate is really primarily to help you move your bowels and be a cleanser for a pre uh, colonoscopy to clean out your bowels. But if you take magnesium citrate in smaller amounts, then it helps you with your bowel movements and oral vitamin C. Magnesium glycinate is absorbed more and is more longer lasting, and it is much more relaxing for the muscles. So yeah, that's what I would do. John says, I read that excess vitamin D has the potential to result in elevation of liver enzymes. Any comment? John, I've seen that, but only extremely rarely. Once in my life as a doctor, I had one patient who was managing some of their own vitamins, and I had given some, and I wasn't aware they were taking some other D. Their vitamin D level got up, their calcium level raised, their liver enzymes went up a little bit, and they totally reversed it and turned it around. They did go to the hospital and were hospitalized for a day, and they took a calcium chelating item, and they did just fine. So yes, it's theoretically possible. I almost never see it, and I'm using doses of vitamin D in the range of 10,000, 15,000, 20,000 units a day, all the time for years and years and years and years. Yes. So yes, it's possible. John also said, it's been said that it's acceptable to have extremely low cholesterol levels because about 50% of cholesterol sits on the surface of the blood cells and is therefore not counted in a blood draw. That's a real doozy. I don't believe that. In other words, if a blood draw comes up with a very low reading for cholesterol level, it's misleading because there's still a lot of cholesterol present. I disagree. All cholesterol is carried around in lipoprotein packages because cholesterol is fat. It won't mix with the water of your plasma. And so God has these lipoproteins that wrap around it. So I don't know what you read, John, but that's not true. I don't believe that at all. Emily says, my friend was given Paxlovid as a treatment for COVID recently. I've not read particularly good things about it. Your thoughts? How about, well, Paxlovid it tries to inhibit, it's a protease inhibitor. So when you get an early infection, you're trying to stop it taking over the machinery of protein replication inside your cells. Well, guess a wonderful way to do that is to take natural quercetin and take zinc 25, 50 milligrams a day at the onset of a cold, which will be a protease inhibitor and stop the replication of it. Why take Paxlovid? That's my thoughts on it. James says, hi, Dr. Rita, you have any thoughts on the efficacy of taking molecular hydrogen before or after exercise? Well, yeah, it's a extra electron donor, hydrogen, and so it helps with oxidative stress. And, there's going to be the purist who's going to argue you need a little oxidative stress after a muscle workout to stimulate signaling for muscle repair and growth. So they're going to argue that. I think in general, if you got the hydrogen water and you drink it, it's just fine. The hydration is going to help you, and the antioxidant effect of the extra electrons will be a benefit. Brian says, Dr. Rita, first off, thank you for all you do. Well, thank you for being wonderful patients. We all appreciate your dedication and love for keeping us healthy. Can you comment on giving blood? Is there a health benefit? If so, how often? Does your body type matter? And when your body makes a new pint of blood, does that improve circulation? Should a person with anemia of chronic conditions give? In general, if you have anemia of chronic disease, you're not supposed to give your blood for that. You should be under the management for whatever chronic disease you have. But men in general have a higher risk of building up iron. Of course, women menstruate all their lives, and up until the point menopause occurs, women's risk for oxidative damage, aging, and heart attacks is very low. As soon as we hit menopause and we stop bleeding, our risk rapidly equals to that of a male. So, yeah, I do believe a man, and there isn't any real good data suggesting O type blood has a higher proclivity to have hemosiderosis than a B type blood or an AB or an A. But I do think it's wonderful if you're a healthy man and you can give once a year for the just the general welfare of all people, especially if you haven't taken any vaccines of the mRNA type. The blood banks are really looking for people like that. Yes, I do believe that it has some value through reduction of oxidative stress, primarily through the iron metabolism of ferric to ferrous in the oxidative management of iron in our body. Less oxidative stress, the longer you're going to live. Harvey says, "Hi, Dr. E. What are your thoughts on using modified citrus pectin as a detox aid?" I think it's wonderful. And it is usually employed in people with cancer to prevent metastatic disease. And I think there's credible studies out there that say if you take citrus pectin, galactin 3, contents of the modified citrus pectin, that there seems to be a dramatic reduction in metastatic disease in these patients. I'm not sure if we totally understand how and why, but yes, I'm in favor of it. Marilyn says, "I have blood type O. I was recently told by an alternative practitioner that he believes the O type blood has some component that makes O type people less vulnerable to both diabetes and cancer. He says he has observed this over decades of practice. What do you think?" Well, in my 45 years, Marilyn, I'm going to say I think O type blood people in general have more fast twitch type skeletal striated muscles. And muscle research, Dr. Gerald Polak has talked about this a lot, but the O's seem to have this. And that means they tend to be people who are much more active. And maybe that's why they have less blood sugar issues and so forth. So it's interesting. And if you're more active and your blood sugars are lower, that'll mean your insulin is less stimulated, which will be less stimulation for growth of tumors and fat and stuff. So, all these things should be taught and studied in a open discussion. That's why I'm so happy that the JFK Secretary of Health Human Services is now re-examining vaccinations, all of them, whether they should be done or spread out or what all. And we should have an open mind and not come in with pre-committed opinions and be open to looking at everyone's conversation without prejudging them. All right, so I really went over 9 minutes. So God bless you all, and I'll see you next week at 6 o'clock, and we will have fun again and try and help lift each other up to be the healthiest, long-lived people who care for one another. All right, God bless. Take care. Bye bye.